California, the richest state in the world's richest country. But for some, the million migrant workers in the fruit farms, the Golden State has been far from golden. Till now, they've lived and worked in conditions of squalor and degradation that have been described by a Senate investigating committee as a national disgrace. But now things are beginning to change. The migrants are mostly Mexican-Americans, spearheaded by the grape-pickers who organized a 5-year grape boycott. They've won pay rises and union recognition from the giant corporations controlling 80% of Californian fruit farms. It's a breakthrough because migrant workers have never before been able to negotiate anything. In this melon field in Wasco, California, we asked a migrant about his life in the fields, where the temperature sometimes gets up to 120 in the shade.
We work 10 hours, we might get around $15 probably.
$15 for the day?
Maybe, or more.
Yeah, more. How much more? How much altogether?
Maybe. Yesterday we were working over there.
Yeah.
We got $20.
$20. That's about £7 for the day's work, yeah. Do you think that's enough?
No.
Housing is a major problem for migrants, and discrimination is rife. This sign says no dogs, but you often see no dogs, no Mexicans written on the same sign. The houses at this camp are luxurious by migrant standards and show the situation in some areas is improving. But some of the camps are more like prisons, where union officials have been refused entry. For people 50% below the official national poverty line, life is hard. Not even the children escape. It's not unknown for an 8-year-old girl to work a 70-hour week. The union, founded by Cesar Chavez 8 years ago, is still not recognized by the government in Washington, who even bought up all the grapes the public wouldn't buy and shipped them to Vietnam. But the union has finally won out and is doubling its membership every month. One of its main targets is improving the health of its members, whose life expectancy is only 49, 20 years less than the average American. Company clinics are rare, and very often the union's mobile health units provide the only medication the migrants ever see. The average medical expenditure of the migrant worker is a pitiful $3 a year, and the Senate Investigating Committee was told of one hospital which informs migrant mothers, pay the bill or we keep the baby. Malnutrition, overwork, and the long-term consequences of child labor are important factors in shortening the lifespan. But the major threat comes from pesticides. In a random test on 800 fruit pickers, 85% of them were found to be suffering from some form of pesticide poisoning.
I'm going to put some alcohol in here.
The migrants' problems are many, but they could be tackled confidently if their social and economic plight could be resolved. Marion Moses is administrator of the union clinics at Wasco. We asked her how she saw the situation.
Well, you know, there are many problems. The biggest problem the workers have is they're exploited economically because of not being paid enough for the type of work that they do. And we see it, you know, I'm working in the clinic and I've been here for about 4 years, and we see the results of this very vicious exploitation. Because, you know, denying a man money, giving him $1 an hour instead of $1.65 or $2 an hour is one thing, but telling a man that, you know, he can't buy medicine for his children or he's going to have a shorter life expectancy, and the life expectancy is only 49 years in the migrant worker, is quite another thing. It's a very serious problem.
What effect does the exploitation take? How does it shape?
Well, I think as far as health goes, it takes many, many forms. I mean, I'm sure you've seen some of the housing here. You've seen the way the workers look. We have 35 and 40-year-old men who are, you know, physically they're just worn out. We see a lot of diabetes, a lot of hypertension, a lot of very, very serious diseases. We get people coming in who've never seen a doctor before. It's the first time. And by the time they do come in, they've been sick for so many years without seeing a doctor that they have multiple pathology. They're very, very sick indeed, you know. And it's very, very different than the population that I'm used to working with, you know, when I was in San Francisco before I came here, or in any big city. It's a very, very different type of thing.
Do you have an answer to the problem?
Oh, of course. I think the problem is, see, farm workers are being denied their health rights as long with all their other civil rights. You can't exploit a human being and not feel this in every aspect of his life. And I think that he's got to be brought into the mainstream, and that's what the union drive is all about, to bring this person into the mainstream. And once he gets a fair deal for, you know, it's just simply a matter of paying him a just wage, treating him like a human being, and then he'll buy his own house. You won't have to put him in a camp. And he'll be able to afford the doctor and take care of his children so that they don't have to pop their eardrum and die of pneumonia because it's gone so long. No, the thing to do is, we don't have these problems in affluent America. We don't have these problems. It's very easily solved. Just give them their proper share.
Yeah, how soon will it be
Oh,
solved?
well, now, being optimistic and putting a time on it, the beginning, it's begun. And the important thing is, I can see many, many things that have happened just since we've been signing these contracts recently. I think that we're over the hump, but then I think the real job is just beginning, because we've got a lot of people coming here now. Our clinic facilities are really overloaded, and this is true in the hiring hall, the membership, everywhere, in the whole union. And our job now is to really service these workers and do a good job and bring in all the other workers. We've only got a small part of the industry, and to bring in all farm workers. There's about 3.5 million of them in the United States.
And how many belong to your union?
Oh, we've got, I don't know in numbers. You know, I don't even know, we probably signed contracts yesterday that I don't even know about. I really don't know what the membership is now. I'm sure it's double what it was a month ago, you know, or 2 months ago.
The migrant movement is a peaceful one, and its gains have been modest. But much more needs to be achieved if we're not to see the emergence of a new, violent, brown power, because the migrants are now organized, and although they've just won a major battle, they've not yet won the war.